Good afternoon, everybody, and I'm really pleased to be up here again. First time I've been at NIPEC conference in 5 years, and very much looking forward to the day. And I think it's been a great programme and a nice variation between the messages this morning and this afternoon. And when I was thinking about how I would finish the conference, really, in terms of the organisational commitment to professionalism, I wanted to do two things, really. First of all, give you a sense of what are some of the barriers and the building blocks around professionalism from an organisational perspective. And then I wanted to ensure that all of the trusts have a voice, because for me, one thing I've learnt from 4 years I've just spent in England is a little country of this size could do a lot more together as one in terms of nursing and midwifery practice. And there are 5 short stories, 3 people in the room in terms of Michelle and Colm and Geraldine, and then 2 short videos at the very end. And that's our celebration of professionalism. But first, I'll just say a little bit about the organisational commitment. And I'm just wondering, should I be pressing one of these buttons? It's just that there, isn't it? That's it. Okay, so I have only one slide, and for me, that's the kind of message that I might offer regarding what is a trust as an organisation, because it's not just the trusts who are represented here today, of course, the hospice world and so forth. So I really believe that when you think about the NMC guidance, which refers to professionalism being characterised by autonomous, evidence-based decision-making that is realised through purposeful relationships and underpinned by environments that facilitate professional practice, there's a huge organisational responsibility. And just for really a minute or so for each of these, if I could just say that taking them in turn, leadership enabling professionalism in practice. So if we're really striving for safe, effective, person-centred practice, it's my commitment and really view that we need to combine collective leadership with transformational leadership and indeed compassionate leadership. And a 2016 study referred to just short of 50% of people across the whole of the NHS who emphasised that building culture is a necessary leadership skill. Perhaps no big surprise there, but building culture and an effective culture is not an overnight job, and it's a real challenge for all of us collectively and individually. So whether you're part of a very small team or working at an organisational level, we all have an opportunity to build culture. And the IHI published last year a really helpful document around leading a culture of safety. And they referred to when risks are acknowledged, when responses to adverse incidents are communicated in a blame-free way, when reporting is encouraged, when there's collaboration across disciplines, when there's a real commitment to providing resources to address safety concerns. Those are really strong building blocks for a safety culture. And if any of us work in that team or in that organisation, we're in a good place, and we shouldn't leave it. But if we're not, we should ask ourselves, in terms of our professionalism, what is our responsibility and our commitment to be part of that safety culture going forward. And collective leadership is all of our responsibility. We are all leaders. And it's a responsibility that's shared in and across teams. It's interdependent, it's collaborative, it's about prioritising quality care, and it's consistent across the whole system. And you'll know that those behaviours include role modelling leadership and best practice, about facilitating practice improvement through reflective learning, and it's about nurturing purposeful relationships. Moving then to the second area that I feel is really important in terms of the organisational commitment, creating psychological safety and joy in the workplace. So if we just reflect individually, just as we're sitting or standing, how difficult is it to speak up in your work setting regarding a problem that you might perceive with patient care? Is your environment emotionally healthy? Are people that you work with, are we individually burned out? Are we exhausted, frustrated? Are we overworked? And feeling psychologically safe, for me, is a really important component of a culture that values and nurtures professionalism. And we will know, I'm sure, that people feel psychologically safe when they really believe they won't be punished for making a mistake. So as leaders, and let's just keep remembering that collective leadership culture, we're all leaders. As leaders, we should then create an environment where people feel comfortable and have opportunities to raise concerns or ask really challenging questions. And there's a guy called Paul Santagata, who's a head of industry in Google, and he's been writing in recent times that we can achieve an increased psychological safety at least through 6 key things. First of all, approaching conflict, and there's conflict in all of our workplaces at certain times. Approaching conflict as a collaborator, not an adversary, and that prevents disengagement and prevents workplace helplessness, which is quite common. Speaking on a human-to-human way, in a human-to-human way, and if you just Googled a little reflection called "Just Like Me," it's quite useful little exercise in terms of how people feel in situations, and anticipating how people are going to react, and planning counter moves, let's say. And then replacing blame with curiosity. And Annie made a point about curiosity and professional curiosity. And if we replace blame with curiosity, there's a good chance that we will reduce defensiveness and disengagement. And asking for feedback often. And finally, measuring psychological safety. And there's a lot of tools, and organizations have, I believe, a responsibility to find ways of developing that culture that shows that professional and psychological safety, I should say, is really valued and strengthened. So being accountable includes raising concerns with confidence. And when we are confident, we're content. And when we are content, we're hopefully happier at our work. And a guy called Aaron Otonoski in 1979 was writing about health, stress, and coping. And he talked about burnout and joy in the workplace. And he talked about control, connection, camaraderie, comprehensibility, manageability, and meaningfulness. And so control is about having a real sense of coherence about what we're doing. Connection between what we are individually thinking and doing and the bigger picture. Camaraderie is often about things such as mutual trust. Comprehension is about making sense to me and my team about what we're doing. Manageability, that I have the personal and external resources to manage my work and our objectives as a team, as an organisation. And is it meaningful? Is it good for patients, for families, for staff? So the culture that enables individuals and collectives to flourish, for me that culture is one where there's true learning. We often talk about a learning and development culture, but a true learning and development culture. So in 2014, Brendan McCormick and Annie Kitchen were referring to flourishing and human flourishing and enabling our individual potentials to be maximised. And I believe organisations have a responsibility, and you'll see the word flourishing in the NMC guidance on professionalism. Organisations have a responsibility to enable people and teams to flourish. So care settings that enable flourishing, developing and nurturing resilience, again a term that's been used recently at this conference, where person-centred human relationships are valued and nurtured. And there's been a lot of reference, Denise took us through the collaborative approach to quality improvement. And when there's a really strong commitment to learning, to continuous improvement, to measuring and analysing, interpreting data and implementation of change and open and honest feedback, well, for me, quality improvement methodology and all of our trusts are embracing that. That's a really strong enabler of individual, collective flourishing and also professionalism in practice. And so I just challenge us all and encourage us all, whatever area that you work in, from the beginning of life or neonatal care right through to the end of life, to think about our settings, our opportunities, and how we can flourish ourselves and enable others to flourish. And of course, people like myself who have responsibility at board level have to be thinking about how we enable that right across the organisation. And finally, evidence-informed practice, midwifery and nursing practice, and the really important attribute around professional judgment. And last month, the King's Fund and the Picker Institute have published an interesting report which assesses the risks to care quality and staff well-being in an NHS that's under significant pressure. And you're experiencing that every day wherever you work. And there's a wealth of evidence in that paper, if you look for it, which demonstrates a link between staff health and well-being and impact on safety and quality. And there are many opportunities and examples, but I'll perhaps just touch for a minute on normative staffing, a really strong policy driver within our health and care system. And next week, the district nursing framework will be launched, and there's current work around delivering care and district nursing normative staffing. And in England, just last week, there was publication of work that Crystal led with NHS Improvement around safer caseloads. And I'm just, for premises of time, focusing on safer and normative or adequate staffing in community teams. And I would suggest then that a really strong attribute of professionalism is our ability to really understand the importance of professional judgment alongside evidence-based decision-making to inform normative staffing wherever we work. And professional judgment includes, for example, if you're a team leader, utilising your judgment alongside your team's experience and collaborating right across your team, taking account of the actual workload, understanding the workload, and including all activities, whether they're planned and unplanned, and informed decisions that are required and determined by both the numbers within a team and the experience of the team, and validated then by peers. And there's a lot of work, and our country has led on normative staffing, and for me that's something that we must continue to develop across all aspects of professional nursing and midwifery. So I really want to move to our colleagues and the celebration of professionalism, but in doing so, whether you work in safeguarding children or whether you work with people who have a complex disability or a mental health problem, or if you're leading an initiative understanding a particular challenge around flow, or around enhanced care, or delayed transfers and so forth, you can apply these principles right across. And professionalism, as we said at the very beginning of this conference, is a 24/7 commitment. And there are some really important messages from all of those other speakers that maybe Angela referred to. And I'll just offer two. And one was about valuing professionalism and standards and continuing to develop the narrative around that. And there are many ways in which we do that. And to come back to Gareth, the importance of professionalism and our willingness to embrace technological innovation, and Annie's points around being positive around change, being curious to change, and a relentless focus on improvement. And that's about collaboration and partnership. So I think, Geraldine, you're going to come and continue the story. And this is the good bit now, because it's about the 5 trusts telling their little stories of professionalism. It just requires that there.
Grand. Okay, thank you. Okay, good afternoon, everybody. My name's Geraldine Byers, and I'm Divisional Nurse in Surgery in the Belfast Trust. And I've recently moved to the Surgical Division, having spent my whole career working in emergency care. And I suppose that's where this piece I'm going to talk about really relates to. So many years ago, when I was a junior staff nurse working in the Royal Emergency Department, I recall a senior colleague of mine describing being a nurse as like being an actor on the stage. And I've reflected on this statement many, many times over the years, and despite my initial objections to this comparison, I've actually come to realise that this analogy represents nurses' role modelling professionalism. This isn't about nurses being insincere or false, but rather about us fulfilling the role that is expected of us. As nurses, we need to be aware, self-aware at all times, and acknowledge the powerful impact that our behaviour has on others. When we communicate, does our body language and our facial expression always say the same message as the words coming out of our mouths? When we write correspondence by email, do we afford the recipient the same level of courtesy as if they were standing in front of us? Like actors on a stage, nurses are involved in live action with patients and their relatives, very often at very difficult and poignant times of their lives. We don't get a second chance to get it right. There are no opportunities for a second take. We're always in the spotlight. We're always being observed by our patients, our relatives, and let's face it, there's very little else for our patients to do on our hospital wards nowadays other than to watch us. We're always being observed by our professional and non-professional colleagues, our peers, our seniors, and our juniors. As professionals, we're expected to behave in a manner synonymous with the role. Our patients expect us to be competent, caring, and compassionate. When we survey our patients, we want to know if they have been treated with dignity and in a respectful manner. Were the nurses kind and empathetic? And we need to strike the balance between coming across as being genuine and authentic against projecting our own issues and concerns onto our patients. We don't need to tell our patients that we've X number of vacancies or that somebody has phoned in sick for night duty. They can see that we're busy, that we're run off our feet. Role modelling professionalism is a powerful way of passing on knowledge, skills and values. It's a way of shaping the practice of our future workforce. Role modelling professionalism is a fundamental responsibility that comes with being a nurse. We all need to rise to the challenge, especially in these difficult times. Thank you.
Good afternoon, everybody. My name's Colin O'Neill. I'm an emergency nurse practitioner and a nurse manager. And it was with some trepidation that I agreed to come and speak to you this afternoon on the invitation of Dr. Bob, our Director of Nursing. A big deal to stand in such a large group of your peers and speak to them about professionalism, as we're all professionals. So I'll give you a little bit of insight into where I come from. I've been a nurse practitioner for 14 years, and approximately 10 years ago, in the west of the province, we got a big knock, and we were told services were changing, and acute services were going to be withdrawn from Omagh and moved. So, in Omagh, we decided we have two things we can do here. We can lie down and be beaten, or we can stand up and rise to the challenge. And we decided we would rise up to the challenge and lead by example in providing new, innovative services, led by nurses, guided by nurses, and performed by nurses. So this was great. For the last 10 years, we've developed the services. I'll tell a little bit more. But about 7 months ago, we in Omagh had the opportunity to move to a brand new facility, a new hospital. And at that time, we had amalgamations of services, where services moved into shared spaces. And in the area I work, we had the Urgent Care and Treatment Centre, the Cardiac Assessment Unit, the treatment rooms in the GP practices, and the GP out of hours put into one unit to share the space. It definitely had plenty of challenges. At the same time, the ward manager for the Urgent Care Centre and the ward manager for the cardiac assessment unit both decided to retire 4 weeks after the move. So an expression of interest went out. Was anybody interested in standing up to the appeal to take on the lead? And I was the only one. And people said to me, "Are you wise? You're already at the top of your band. You know, you have your own sociable hours. Why would you take this on?" Very simple. I wanted to lead. I wanted to inspire. I wanted to improve and develop and expand the services that we as nurses already deliver. So I'm going to just speak briefly about what we do in OMA for people that don't know. Is that going back? Yes, I'm colourblind, sorry. So Bob sort of asked me if I'd come and talk about how I, as a manager, enable professionalism in urgent care and cardiac assessment unit in the OMA Hospital Primary Care Complex. The Urgent Care and Treatment Centre is a nurse-led 24-hour service, 7 days a week, 364 days a year. It's run by nurse practitioners and highly skilled Band 5 staff nurses, a HCA and support services. We share the facility, as I've already said, with other disciplines. We assess, treat and discharge throughout the lifespan, so we see them from they're born to they die. We treat a wide range of conditions from the very minor to the most complex, serious injuries. A lot of people say, and when we first introduced the reduction of Colles fractures, we were said, "Oh, you can't do that, you are nurses." Why not? Of course we can, with the proper education, the proper training, and the willingness of the staff. So we quite successfully now save people journeys of 30, 40 miles each way by being able to provide the treatment locally. And that's what professionalism is about. It's about providing safe, effective care locally to the needs of the people. We refer to many specialities, and I'm sure a lot of you will have come across us in OMA referring up to your units. I like to think that we are very professional in how we carry out our role as nurses in referring to the specialities. We never have any complaints, which is always a good sign from the specialities. We see approximately 8,000 patients a year, and it's growing. And we are looking at how we can grow it further. So that's just the urgent care centre. I also manage the cardiac assessment unit. Again, the cardiac assessment unit is a 24/7 nurse-led unit. It assesses patients from the ages 16 and over with unspecified chest pain. They basically will see, assess and treat whatever comes through the door. They work within pretty strict protocols and guidelines, but that doesn't really acknowledge the skill and expertise of the nurses working in the unit. They see about approximately 4,800 patients a year. When they started off, they were seeing about 1,000 patients a year. The service is growing. The figures sort of say a lot, don't they? 75% of the patients who attend this unit are discharged by the nurses. It's not the doctors discharging them, it's the nurses. 23% are consultant-led discharges. So what happens is, for these 23% the nurses are concerned about, they make phone calls. They speak with their colleagues, the medical colleagues in Auchnagalvin Hospital. They discuss the cases, they discuss the results, and they come to a decision. And sometimes that decision is that the patient's kept to the next day till we have a visiting consultant, or sometimes the consultant will make the decision over the phone. 2% of patients leave the service without approval. So how do I, as a manager and a nurse, enable my colleagues to be professional? So I thought long and hard about this question, and I thought I could come here today and stand up and talk and reiterate work that's already done. I don't think you want to hear that. So for me, this is what it's about. From an organisational point of view, we enable professionalism through our code and through the standards of practice that help and enable us to provide safe, effective care. Through our national bodies, by setting standards of education that are second to none in the world, and through our trusts who set policies like our uniform policies, because the way we present gives an impression, through mandatory training to help us provide safe and effective care, manual handling, infection control. I, as a manager, as a role model, working on the floor along with my staff, providing guidance, giving opportunities for reflection. I hold regular meetings. Every 6 weeks we have staff meetings. At these meetings, this is where I pass on information that has been passed from the organisation to me, but it also gives the staff an opportunity to feed back to me about how we can develop and bring the service forward. And for the staff, individual accountability, reflection, revalidation, all the buzzwords. I have to say, I'm proud to be a nurse, and I'm proud of the nurses I work with. Thank you.
Good afternoon, everyone. My name is Michelle Portis, and I currently work as a ward manager on the antenatal and postnatal ward within the Southern Trust. So today I'm going to present to you how, as a trust, we have promoted professionalism within midwifery following the development of my diabetic education pack. So in August of last year, I was fortunate to have been given the opportunity to undertake a developmental role and work alongside the lead midwife. And it was during this period that it became evident through day texts that there was a number of medication incidences involving insulin occurring. So as you well know, as midwives and nurses, we have an accountability to adhere to the NMC code by preserving safety, promoting professionalism, practicing effectively and prioritising people. So therefore, an investigation was undertaken into these incidents. To achieve best results from this, I adopted a multidisciplinary approach and liaised with all professionals involved in the management of pregnant mothers with diabetes, and this identified issues prevalent in their areas which were of concern, such as a lack of clear guidelines and competence of practice. So using all of the information collated from this, I then devised the diabetic education pack. So I decided that a pack format would be the most suitable option, as this approach ensured that all relevant information and guidelines and related documentation were all presented in a single available format. And this again necessitated a multidisciplinary approach to allow all areas of professionalism to contribute information that they deemed appropriate. So as you can see on the slide, the media contained within the pack is displayed in a clear and concise manner with the use of coloured flowcharts to explain the management of a mother with diabetes in all potential scenarios. And each flowchart is a start to finish step-by-step guide for correct protocol in that scenario. The pack doesn't just outline practical care, but also what documentation is to be completed and how it's to be completed correctly. So during the implementation of the pack, I met with midwives on a one-to-one basis and provided each with a copy after I had taken time to go through it with them. I then devised an evaluation form, and this audited staff satisfaction and the learning from the pack, which I have to say to date has been very positive, with 100% of respondents stating that they find it extremely useful and that their level of knowledge and confidence increasing as a result of it. I'm also very happy to say that from the implementation of the diabetic pack, that there's been no further insulin-related medication incidents within maternity. So to sustain this success, I have shared the learning with Queen's University in Belfast to be used for the training of student midwives. I've also shared with my obstetric colleagues through directorate meetings, and I also plan to incorporate this pack into the induction for all new midwives within the Southern Trust.